The underlying philosophy behind BHS and an ADX specialty network is truly getting back to healthcare and not sick care. The current system focuses on an illness or a condition and then manages that condition. And sometimes that's the only option we have. But so many times there's a much better way of dealing with the underlying problem that caused the condition to begin with. If you can address the underlying problem, then even if the condition does need some treatment, it's likely to be resolved, as opposed to being basically an annuity for the sick care system to just keep revolving through. Our job, all the way down to the on-site nurses and up to the specialty surgeons, is to put ourselves out of business pretty much every single day. If we can keep somebody healthy and steer them on that path of a healthy lifestyle, the likelihood of them needing our services diminishes. That improves their quality of life, decreases the cost of overall care, and gets us back to doing what we're supposed to be doing in healthcare. BHS conservative care model is very different than anything else in the current system. We have nurses who are highly skilled and selected. They're many times on site with employers. And what is conservative care? Conservative care is listening to the employee and then hands-on treatment, basically non-invasive. We're starting with a symptom, and many times we can resolve the condition just based on a symptom. We don't have to get to the details of a very specific diagnosis. However, the treatments that we utilize are things like red light, shockwave, hands-on treatments, and 3D mobility tools that let us look at how a patient moves and how do we optimize that without getting more aggressive intervention. And many times we don't have to, and that's a great thing. We also look at lab tests. Remember, if I get you physically better temporarily, but we don't treat an underlying metabolic condition that's causing you to be sick continuously, then we're always going to fail, or we're always going to be back treating you. The goal is to get you out of our offices back to your life. And as a specialist, if somebody fails out of that system, and most don't, it's the 80-20 rule. 80% of people are going to get better without ever needing the specialty side of what we do. But if they do fail out and they come up into the specialty network, I already know that they have had the optimal treatment to get them better quicker with non-invasive conservative care, so that then it is time to escalate and become much more specific as to why did they fail and what do we need to do next to get an accurate diagnosis, get them into treatment, get them back to their life. So why should an employer add BHS and the specialty side of the network that we offer? There's so many reasons. It's almost like let's start talking now and we'll talk for another half hour. But really it comes down to employees are an employer's biggest asset. Healthcare costs are their greatest cost. And when you look at the investment that an employer makes in their employees, then the real question is, why wouldn't they add something that would look at the employee's overall health, optimizing their health, optimizing their life, and their on-the-job performance? When we look at costs in healthcare, most people focus on what is the individual visit cost or surgery cost or whatever. And yes, those are significant, but the most important ones are indirect costs. An employee that comes to work but isn't all there, it's called presentism. And they're struggling with it, but they don't know where to go, or the current system has failed them. And if it gets really severe, then the employee has to be replaced. And that's a huge, as an employer myself, that's a huge impact to try to replace a valued employee when what they really need is BHS and ADX to keep them healthy, keep them in their life, keep them on the job, and have a very stable employee workforce.